The following is a presentation of Spark Study Club. To see our course library and claim your free lifetime membership, visit sparkstudyclub.com today. Enjoy the podcast.
Hello, everyone. I'm Adrian from Spark Study Club, and today we are joined with Dr. Shaun Young, who has an upcoming webinar titled OraGen, a powerful cellular bone matrix for predictable regeneration in complex defects. And that's going to be on March 25th at 8 p.m. Eastern, 5 p.m. Pacific, which you can register for on sparkstudyclub.com website. Registration form is there. And so yeah, let's get to know Dr. Young. I think you're going to be with Dr. McAllister doing some Q&A and doing a presentation. Again, that is March 25th. So thank you for being with us, Dr. Young, first and foremost. I'm going to go ahead and just list off a couple things about you. It says Dr. Shaun Young attended University of Florida College of Dentistry and earned his Doctor of Dental Medicine degree while also serving as the dental school class president for 4 years. Dr. Young completed his oral and maxillofacial surgery residency at Emory University in Atlanta, Georgia, where he also served as the administrative chief resident. His exceptional surgical training and exposure to multiple community hospitals serving diverse populations have afforded him invaluable experience and knowledge in all aspects of oral and maxillofacial surgery. Dr. Young's surgical expertise includes complex ridge augmentation, immediate implants, and all-on-X surgery, dentabular surgery, orthodontic surgery, and maxillofacial trauma and reconstruction. That is a lot. That is a lot of blood. Thank you so much for joining us, Dr. Young.
Uh, yeah, thanks,
Um,
Adrian.
yeah,
Yeah, no,
absolutely.
thanks for having me. I'm really excited about this upcoming webinar. I do a lot of speaking now on ridge augmentation, and I would say a big portion of my practice is reconstructing really complex ridge defects. And I think, as an oral maxillofacial surgeon, and as dentistry continues to evolve, we sort of are relied upon our skills and expertise at a little bit higher level. I think there's a lot of general dentists now that do a lot of great surgery. And so we're sort of being asked to perform cases that are, maybe a little bit more complex or complicated. And I think new technologies are coming out, new grafting materials are coming out. And so the product that I'm going to be talking about with Salvin, which is called OraGen, is basically the first dental cellular bone matrix which contains viable bone cells. So we know that, in order for predictable ridge augmentation to occur, we really need three properties, and that's osteogenesis, osteoinduction, and osteoconduction. And prior to this, the only avenue we had in order to achieve that was by using autogenous bone, which we still do in many of our cases. We know how well autogenous bone works. It's been the gold standard for years, but not all patients have a lot of autogenous bone that's available. Some people have really atrophic jaws, or their medical history may prevent them from having or being a great candidate to have a second surgical site. So to be able to have a bone product out there that contains viable bone cells and that might have that same osteogenic power is really, really cool. And so it's a product we've been using for, I guess, almost a year now. We started using it when it first came out. It actually has been out in the medical field for quite some time now. I want to say 7 to 8 years. Don't quote me on that, but it's been out for a while. Synthes was a distributor, and so a lot of our colleagues have used it already in the operating room on the medical side. And so it's a proven product. It just took a while, I think, to get it over onto the dental side. And now a lot of people, people are always looking for different ways in order to help with outcomes and specifically really complex ridge defects. So
Would you say that that has changed has that shaped and changed how you approach oral surgery today?
yeah, to an extent, definitely. I think it's just nice to have alternative options. Not every. I think the longer I've done this now, I've been in practice almost 9 years now. I think the more tools you have in the bag and the different skills you have and the different ways you can approach a case is just helps you, because not every patient is a great candidate for a titanium mesh. Not every patient is good to harvest autogenous bone. And so you kind of have, there's multiple different things that we look at now when we decide what the specific technique we're going to use, what specific bone products we're going to use, which membranes, and things like that. So this gives us a whole nother avenue and, a great, allograft really that has not been available prior to this.
So what would you say a type of case that the OraGen's best suited for?
So we've used them really in all sorts of cases now. We've used them in posterior mandibular cases, which seem to be the most common types of ridge augmentation cases that are needed to be grafted. Several patients that lose their lower molars for years and they've just not had any posterior teeth, and then at some point, maybe things change in their life where they're now able to financially invest into their health and their teeth. And so we've used it on posterior mandible. We've used it in sinusless. We've used it in anterior maxillary defects. I would say, in general, patients that are just not great candidates for autogenous bone, or let's say you're grafting a site like the anterior maxilla or the posterior maxilla, where there's just not normally a lot of available bone to harvest from. In other words, if we're doing the mandible, we can always go all the way back to the ramus and we can harvest bone from the ramus, and it's sort of the same surgery site. So we're not really opening up, a second surgery site. So it's not creating necessarily additional post-op discomfort for the pain. But I think in some of these maxillary cases or posterior maxillary cases where there's not a lot of available bone, then we can turn to OraGen, right? Or even we've done OraGen now in some cases for teenagers that have congenitally missing lateral incisors, right? And those are always difficult cases because these are teenagers, they're young patients, it's the aesthetic region, and you really only have one chance at grafting it correctly. I mean, if you don't do it correctly the first time, it gets much, much more difficult to achieve a desirable aesthetic result. And so traditionally, we would always do block grafts for these because they were predictable. It was autogenous bone. The grafts were stable. We knew that they worked, but it certainly involves a second surgery site. There's some potential complications. There's some nerve injury risk, and so having an alternative where we don't have that has been great, and we've used it there successfully. So there's definitely a lot of great cases where this is can be just as good of an option as using autogenous bone.
In using this product, what's the most unique or challenging case to date that you've used this for?
Probably the first case that I actually used it on. I had heard a lot about it, right? And it's a product that kind of requires a lot of planning. We now have a cryo freezer, so we can actually store this now in our office. But if you don't have a cryo freezer, then it gets shipped in dry ice, and Salvin can usually get it set up so that it gets to your office within 1 to 2 days of when you order it. And once it gets there, you got to use it within 48 hours, or it could potentially thaw out, and you could lose the viability of those bone cells. And so when I learned about it, and Christy, who I love very much from Salvin, she told me about the product. I said, all right, I actually have the perfect case. I have a lady who has had her posterior mandible grafted already 2 times and it's failed twice. So she actually came to see me for an all-on-X consult for the lowers. So she was basically missing everything behind her left lower canine. And she had a couple implants on the lower right, which were doing fine, but she still had her anterior 6 teeth, which really didn't have any issues. But she had a big vertical defect in the posterior left. And when she came to me, she said, I don't want another graft, but I want teeth back here. So if that means extracting the rest of my teeth and putting implants and doing this quote unquote hybrid, then that's what I want. And, it initially I was kind of on board for it because the patient, that's what she wanted. And I kind of understood her not wanting to go through another large surgery again. I mean, these surgeries in general are quite painful, and they can be a little bit difficult to recovery from, especially the first few days. But I eventually was able to talk her into letting me try, and I said, "Look, I haven't tried yet. I think we may have a product that would work for you. This is if this doesn't work," I said, "I know it's going to be, it's going to kind of suck for you from having to recover through it. But I said, in the worst case scenario, if it doesn't work, then I won't charge you for the surgery. And whatever you paid for that, I'll apply it to the surgery to remove all your teeth and place implants and get a full arch." And so she agreed to it. We grafted it. It ended up healing really, really well, and we were able to get a couple implants back there. And she's now restored, and she's got an implant bridge in the back, and she's obviously thrilled because she always thought she was never going to get teeth back there. She thought the only way would be to extract all of her teeth. And so that was a really difficult case, just because it was a patient that already had a couple failed grafts, and so that soft tissue is always a little bit more scarred down. It's a little bit harder to get the periosteum released for closure. But once we did that case and it worked well, I kind of knew, like, the proof was in the pudding at that point. Like, this was one of the most difficult cases I've had to graft, and it worked. And so since then we've used it a lot.
That's amazing. That is amazing. Okay, so what is a misconception that could be spoken about with OraGen that you've heard? What's the biggest misconception?
Probably the expense, right? It's
Mm,
obviously more expensive than just a regular allograft that's on your shelf, but that's also because you're getting a much different product, right? You're getting viable bone cells. There's obviously a very rigorous process that has to go through in order to maintain those viable bone cells and get it, to remain sterile and keep it, get it transported, whether it's across the country or whatnot. I always tell people for these cases, like, if the product is five, six, $700 more expensive than what you're normally using, how much more expensive is it if you perform a case and you do a ridge augmentation and it doesn't work, or it fails, and then now you have to retreat it and do it again, right? I mean, to me, that's way more costly, not only from a money standpoint and having to use additional product, but from a time standpoint, that's much more costly. So to me, if it means spending a little bit extra money, but also having more confidence, knowing that I'm going to get the result that I need the first time, then it's totally worth it.
right. Yeah, that makes sense. Definitely. Okay, couple more questions. One is where do you see oral surgery just in general in the next 5 years?
So I think what we're going to continue to see more surgery. We're going to continue to see the digital side of things. So we've kind of jumped on that wagon a couple years ago, and we're sort of doing a lot of digital stuff. We have a fully digital workflow for all of our full arch cases. We do a lot of digital stuff now for even individual teeth and immediate implants, and I think it's great. I mean, it's more efficient, it's more accurate, it's fast, it's better for patients. And so that part of it's exciting. Obviously, AI is taking off as well. I don't know how much AI will really get involved from the surgical aspect. I think there's just too much detail and too much nuances. I'm not concerned that robots or machines are going to start doing the surgeries that we're doing. There's obviously like the Yomi is out right now, which is sort of like a robot that can help place implants. You just kind of help guide it, but I'm not too concerned about stuff like that.
Good. And then that was a very awesome answer, and there's a lot to it. And I'm
Yeah.
sure that you will touch more on that when you guys do your webinar on the 25th. Is there anything else about the webinar you want to touch on? Some highlights to get people excited to register and join?
Yeah, no, I think, like, if you're a surgeon or even a dentist that does a lot of surgeries, and you've ever done bone grafting cases, ridge augmentation cases, and maybe not gotten the results that you had hoped for, I would think that's includes almost everyone because that's even happened to myself. I think this will be a great webinar because not only am I going to touch on a lot of the surgical techniques that have really helped me to achieve a lot more predictable results in my practice, as I feel like now I've had quite a bit more experience and I've been almost in practice for almost 9 years. But I think it's just a great product. And for some of the more difficult cases that really need some sort of osteoinductive or osteogenic material, and if you're just not comfortable harvesting autogenous bone, or you have patients that are not great candidates for that, then this is really this is a product that I think people really want to use. So I'm going to be showing a bunch of different cases on how we've used it. I'll show everything from start to finish so people really get to see the results. I have an awesome case I'm actually doing tomorrow that I grafted about 4 or 5 months ago. Actually had an early mesh exposure. And I think because of the OraGen and the fact that it calcifies and mineralizes really early on, I think is why we ended up getting still a significant amount of bone regeneration, even though we had an early membrane exposure. So it's exciting that I'll definitely show that case. And I think there'll be a lot of great cases for people to see.
Awesome. Well, we're excited for the webinar on March 25th. Thank you so much, Dr. Young, for joining us today. And hopefully you all register for this webinar on OraGen. You can go to sparkstudyclub.com to register. Again, March 25th. It's going to be live at 8 p.m. Eastern, 5 p.m. Pacific. And yeah, we're excited to see you all there. Thank you so much.
Yes. Thanks, Adrian. Looking forward to
Thank
seeing you
you.
guys.
We hope you enjoyed this podcast. To learn more about the topics discussed, please visit sparkstudyclub.com today and claim your free lifetime membership. Thanks again for listening, and we hope to see you again soon.